Hi everyone on Facebook and on Instagram. This is a very special day for me. I have Miss Joanne Michelle Martin joining me today, and we are talking about hip pain and the connection to the pelvic floor. I'm just getting set up here on IG, guys. 1 second. And Jay, you want to add yourself here to IG?
Oh yeah, tag me at the pelvic perspective.
Okay. How is everyone doing today?
Happy Friday, y'all.
No, it doesn't feel like Friday at all.
It didn't feel like a Friday. Everything flows together now. Everything flows together. I was struggling all the beginning of this week going, what day is today?
I know, it just seems so it's
yeah.
There's a lot going on. There's just a lot going on. There's a lot of people going on. I've tagged you on IG, so check that out. And then let me add you, and then we can get started and start talking about hip pain and the relationship to the pelvic floor. Guys, this is a very interesting topic because this is something, as a clinician, as an orthopedic physical therapist, for many years, it was something that wasn't quite on my radar. I really saw hip pain and treated it as such in relationship to the lower back or to the knee, and that was about it. And the pelvic floor was completely off of my radar. So I'm very excited to get Ms. J's perspective here to talk about how the pelvic floor.
Getting my BFF.
Yep. Connects to the hip pain and vice versa. I think this is really important info for a lot of guys. All right. I don't see you on IG, Jay. You see my live? I've tagged you on IG. Do you see that? Jay?
I'm on my phone, so I didn't see the tag yet. Can you hear me?
I can hear you. Yes. Okay.
Yeah, I haven't seen the tag come up yet.
Okay. Alrighty. So just, if you don't mind, if you go into Instagram, are you on your phone right now for Facebook?
Yeah.
So I don't think you can do both at the same time unless you have another device.
No, hold on 1 second. Hold on. I might glitch out. Hold on.
Hope everyone is doing well. For guys who are listening live, comment live so I know that you're listening. And if you have questions, anything that comes up in terms of hip pain and in regards to pelvic floor pain, or just have any wonders of what exactly that is, please drop it in the comments so we can answer your questions as we go along. Oh, I think I lost her, but she will be back. Give us 1 second, guys. Comment live if you're commenting live. If you've never even thought about a relationship between hip pain and the pelvic floor pain, you're not alone. So stay with us. We'll have some more conversation with Dr. J and just lots of information to share. Stay with me. And tell me how Friday is going, guys. There's a lot of stuff going on. I feel like here we are. Hi, how are you? A couple of people joining us on IG. Hope everything is doing well. Hope you're having a wonderful Friday. I'm just going to wait a couple of seconds, guys, for Ms. J to join me again. She dropped off. And we will get started. Guys, tell me how Friday is going. How's Friday? Hey, how are you? Do you have any questions for us, Miss M? I can't quite pronounce your name.
Bye.
And Ms. J is with us. Yes, you are back. Yes.
Okay, I tagged you, so you should see me pop. I just tagged you on Instagram.
Or you should. Are you on my live feed on Instagram?
No. I didn't do that. I just tagged you on my page.
Okay, let's keep it going, guys. Guys, that are
we'll make it.
We'll make it. Guys that are on Instagram, I am here talking with Dr. J Martin. As you can see, I'm just going to show you so you see that we're not doing this. Check me out on Facebook. I will probably download this video and maybe post it for you guys for a little bit later. But guys, let's get started. So good to have you here today. I'm so excited to talk about this stuff. As I was talking to guys when you left a little bit a while ago, this is something that was not on my radar of things to talk about in terms of diagnosing hip pain or even diagnosing lumbar pain or even knee pain. It just was not on my radar. And as orthopedic clinicians, we are very trained to very much look at the joint above, look at the joint below, and to make sure that there's no interactions of symptoms or causes of the pain that a patient could be having. And pelvic floor definitely was not on my radar at all. So first of all, just to answer a couple of questions for Ajdi so that we can understand a little bit about the pelvic floor and what it is. So can hip pain come from the pelvic floor?
Yes.
Yes. Okay, tell us more.
Absolutely. And that's, yeah. So the reason for that comes because one of your primary hip muscles, which is an external rotator, otherwise known as your obturator internus, has a direct attachment into the pelvic floor. So I'm going to show you right here on my model. This muscle coming out the back right here, that is the obturator internus. The obturator internus actually, let me make sure that I, there we go. The obturator internus muscle actually is coming off in here. So it has that attachment. It attaches on the obturator membrane. It attaches on the atla, which, you know, us pelvic floor physical therapists just say atla is too much to say, but the arcuate tendon of the levator A9. And then as it exits the pelvic floor, it comes out, wait, there we go. It comes out and crosses through the lesser sciatic notch and goes over here on the posterior part of your hip bone. So that kind of, you know, like when you're standing up, I'm gonna have to demonstrate that. Everybody says the hip is right here, this bone to the side. That's really not your hip. Your hip, actually, the joint is in the groin, but posterior, the back part of the hip is where the tendon will come out and attach to. And the function of the obturator internus is to externally rotate the hip, right? Which we need in a lot of sports. If we're talking, you know, being able to move, being able to cut, being able to run in soccer, being able to kick the ball, you know, you'll see the soccer athletes, you know, they turn their foot outside, they kick on the inside of the foot. Well, in order for them to get the inside of the foot exposed, they got to externally rotate the hip. And so that's its primary function. It also, if the knee is bent, if the hip is flexed, then you can abduct. It can help to abduct the leg as well. So it's quite a bit of at the hip. And the problem is that oftentimes when we're looking at the hip, like we look above and below, but we kind of miss the whole middle when it comes to the hip. We look at the knee. We may look whether it be the muscle connections, the neurological connections, or the fascial connections, right? And those are very important. For example, the obturator is innervated by L5S1 and S2 nerve roots. You know, those nerve roots, they don't just stop there. They travel and they can innervate other places. But we talk about the L5 nerve root. You know, most people are like, oh, lower back, and they may stop with that. But you're not looking at where else this pain can be coming from. And so I think it's pretty important when we are assessing and analyzing any type of hip pain that we don't just stop on the surface. And a lot of that has to do also with, you know, what is a type of pain. So then we have to get into, it's really important in doing an assessment. I might be jumping forward here a little bit, but it's really important when you're going to do an assessment of the hip that you want to know the location. So where is the pain? Because most people say, oh, my hip, and they're back here. And they're like, oh, my hip. Well, even back here, is it high? Because they'll say it's their hip, but you know, now we're getting into not even the lower back. They're like, not my back, by the dimples. Now we're talking SI joint. You know, is it higher up? Everybody thinks everything back here is the piriformis, but you're going to have piriformis pain maybe a little bit higher, whereas that obturator internus involvement is going to be lower. It's literally a pain in your ass because it's happening in and around where the sit bones are, you know. And then you also have to consider, you know, is it a case where it's some of the fascial connections? Is it a case where it could be some bursitis, because you could have some obturator bursitis because there's a bursa that sits right under this muscle and the bone. that can be irritated, and it feels like literally like there's a pain in my butt, but I can't touch it. It's deep.
Got it.
So, I mean, there are a lot of considerations here.
So in terms of, for the patients that are out there that are listening to this, what are the things that they would be alluded to that they may have had a pelvic floor issue? Are there certain things that patients should look for? Are there certain movements that they would have pain with, or specifically that they can say, this may not be a hip problem, it may be a pelvic floor problem? Is there a great way to identify that for patients?
I usually will say short answers. Are you having issues with peeing, pooping, or sex?
Okay.
If you are complaining of hip pain, but you have all of a sudden noticed that, you know, with sometime near the onset of this pain, you've started to have more difficulty with going to the bathroom. You know, whether it be some urinary urgency, whether it be some urinary frequency, maybe you're having a difficult time with bowel movements. It just, you feeling like you're having to strain more, it's hurting more. Maybe you're having pain now with sex, because, you know, nobody goes into a clinic and asks, you know, the patients aren't going in there and being asked about their sexual function. But these are things that are very important, and these are things that are so common in my world, because I'm asking everybody about their sex life. Does it hurt? But it's very, very important, because there's that connection. And again, that muscle, you know, it's inside the pelvis as well as outside at the posterior hip. So, you know, for the muscle body itself, if we're having some issues with the muscle, you can in fact be having some issues, you know, with something like intercourse. The other thing to remember, again, is it's attached to the pelvic floor by the atla. And there's also some fascial fibers in there. So if we've got some muscle tightness now, if we're talking muscle tightness, maybe some fascial restrictions and stuff like that, we all know that there's sort of a continuity when we're talking about fascial tissue. So it's not just going to stop at that one spot. You're going to have, you know, pain that's going to kind of trickle over into some of the other pelvic floor muscles, because not everything is tight. Well, the whole area is tight. You know, everything gets irritated. You may have some abdominal discomfort, because again, fascial tissues, you know, a lot of the fascia is very interconnected. Then we might still have some back pain. When you think about, for instance, if you're having pain, there we go. If you're having pain in
You still there, Jay? Ooh, you may be having some technical difficulties, guys. Oh, I think we may have lost Jay, guys. Oh, today is one of those days, isn't it? We're going to give Miss J a couple of seconds here, guys. Hope you guys are doing well. Hey, Danielle, what's going on? Hey, everyone else that's online.
Now, let's go ahead and wait a second and see if you pop back on.
Are you there?
There we go. Can you hear me?
Yep.
I'm here. Can you hear me?
Yes, I can hear you.
If we're looking at, you know, this is the portion of the muscle still on the inside of the pelvis. The tendon comes and wraps around this way. You know, is it a tendon problem? Are we feeling more stuff more at the posterior hip? Is it inside? Are we feeling stuff deep into like the buttock area? Does it feel like I have a pain, but it feels really deep? The other thing to consider is the relationship between obturator and pudendal nerve. It courses through in the general area where the obturator internus muscle, genitals, and the pelvic floor. So if we have any type of tightness or irritation in that muscle, chances are you can also get some irritation of the pudendal nerve. Some, you know, if the muscle is a little bit tighter, some entrapment of that nerve. So kind of think of, you know, compression of the nerve, maybe some pinching of the nerve, which can cause all types and sorts of symptoms, from burning to tingling to stabbing, pain, maybe numbness. The symptoms can vary. When we start hearing those things, we start neurological. It's not just musculoskeletal. So again, short answer, if people are concerned, maybe this could be a pelvic floor issue, then we're looking at bowel, bladder, and sexual function. And then we also want to consider neurological function. Have you had any changes in sensation in and around the genitals? Have you had any burning, stabbing, shooting, night light in around the genitals? And those things will key in that something to the onset of this particular hip pain.
Got it. So one thing, there you are. Great. I think you just came back super clear, which is awesome. And one thing that I do want to add in here, in terms of the patients that I've seen, specifically the active patient population that I have seen, and that clued me in from a clinical standpoint, that there may be a pelvic floor issues with patients that had persistent back pain, persistent hip pain, or persistent mysterious knee pain that just never quite got better 100%. So it got 90% better, it got 80%.
Goes away.
Even 95% better, but just the rest of that percentage, just that little bit, that 5, that 10%, just kind of kept hanging out there. And that's the kind of the missing link, so to speak, of pain in that area. So guys, for you guys that are listening, specifically patients that are listening, it's important to understand that getting a medical diagnosis is so key, and getting the right medical diagnosis is so key. The body is complicated and filled with redundancies. And in order for you to get an accurate exactly what's going on, you do need to rule out a couple of things. So there are several different ways or several different reasons why you may be having pain in one place. The body specifically designed it that way. So it's really important for you guys that are listening, if you're having persistent back pain, if you're having persistent hip pain, that you tried all of the stuff, you've gone through the exercises, the stretches, it's still hanging out there. It may be a pelvic floor issue that you may want to see a professional about. So Jay, now that we've kind of covered a lot of those things, people have a better understanding of pelvic floor pain, where it can be coming from, what can be done about it. How would you suggest to people that are listening, how would they go about finding a specialist like you, or someone who is able to handle their problem and take care of them?
So there are quite a few of us that are pelvic floors. I mean, obviously now with COVID-19, many of the pelvic floor therapists I know are not functioning in a clinical setting inside their offices. So a lot of us, like myself, we're doing teletherapy, telehealth. And so so finding people is going to be very easy. I mean, you can do a search online. You can look in various directories. PelvicGuru.com is a great one, and has a very, very comprehensive list of pelvic floor practitioners in a variety of areas, where you can, find someone specific to your area and, to help you, or someone that even, has experience in other things. For instance, I work with CrossFit athletes, runners, athletes in general, because I coach volleyball as well. So, I have and love working with athletes. And so if you're an athlete and you want to find someone that works specifically with your people, then you have the option of finding that too. So Pelvic Guru is a great site. I know they update all the time. The American Physical Therapy Association also has, I do believe they have a directory as well, whereby you can go through that, Herman and Wallace. So there are quite a few places where you can find Facebook, because everybody's on Facebook, Instagram.
Yeah.
There are quite a few places where you can find therapists and reach out to people, and maybe if you can't find one in your area, just reach out to someone and say, hey, do you know of a professional in this field that's in my area? Many of us, again, are licensed in more than one jurisdiction. So for instance, I'm licensed here in Georgia, in New York, in Florida. So many of us are licensed in more than one jurisdiction. So we may not be physically located in your area, but may have privileges that extend to that jurisdiction. So
awesome, awesome. And I'm just going to add in one more question that I know I didn't prep you for, but what is one of the big one of misconceptions about pelvic floor PT? And I bring this up because I recently had a patient ask me, and they're like, I know pelvic floor T, it's this really, it's everything down there, and like it's very personal, and I'm kind of weirded out by talking to someone about everything down there. Give me some of the common misconceptions about pelvic floor PT and how it's executed and how intimate it is, how invasive it is. Give us a little bit more detail about that.
So the words that you mentioned are words that I've heard mentioned by patients as well when they express their fear or their inhibitions with regards to having or utilizing pelvic floor physical therapy. Pelvic floor physical therapy in and of itself, this is my BFF, is really a subspecialty of orthopedics. That's all it is. Like, right, we have musculoskeletal training, and as you can see from this, we've got bones, we've got joints, we've got ligaments, we've got tendons, we've got muscles, we've got nerves, we've got a whole bunch of stuff going on in and around this area, and related to not just the pelvic floor, but the hip and the spine. So posture, function, movement, dynamic movement, there's so much going on, sexual function, bladder function, bowel function. There's so many things going on in here.
Yeah.
First and foremost, I think, and I'm not going to speak for anybody else, but what I tell my patients is my job is to listen to you. I'm not going to tell you I need to do this, that, or the next. I need to listen to you. I need to hear your story. I need to hear what's going on. Currently I'm not performing internal assessments on my clients, but I have had clients who have come into my office. One of the common diagnoses I treat is dyspareunia or pain with intercourse. So a lot of my clients are having pain and having sexual dysfunction. And there are times I've had people come into the office and have not laid a hand on them because all they needed first and foremost was somebody to talk to them, somebody to listen to them, and then somebody to explain to them what's going on. And so we go through an extensive anatomy session in a way that they could understand, in a way that makes sense for them. When people, there are times when internal evaluation, internal assessment, internal treatment is going to be very necessary. And that's going to be a gold standard. However, that's also going to be based on the client. If you have a more conservative client, if you have a client who is, maybe more apprehensive, that's not something that you force on them. So what can I do to elicit the same result or close enough that I can do with my client to still make sure that they're comfortable, to still make sure that they get the results that they need? That's what my goal is always with going into the session. So, I educate them. We go through strategies. I try as much to kind of dig into what their daily life looks like. We do a lot of external techniques. I teach them how to do things on their own, much the same as what we're doing now in the telehealth setting. When those people, if necessary, if it is warranted, are ready to have an internal assessment, if it is still warranted at that time, then we go ahead and we do that. But my primary concern is always for the client and making sure that they're comfortable. Pelvic floor therapy doesn't have to be something that is daunting, but what we have to understand is that the primary issues that we deal with as specialists are the issues most likely to upset your life. They come with tons of embarrassment. They come with tons of self-esteem, potentially self-esteem issues, and nobody wants to be peeing on themselves. Nobody wants to be defecating on themselves. Nobody wants to be having sexual issues. I can't tell you the number of people that I know that when they contacted me, their first comment when they were trying to schedule an appointment, I think my husband is going to file for divorce, or my wife is upset because I can't perform. They're not even thinking about the problem directly, but they're thinking about the effect that it is having on their lives, and nobody should have to go through that. So again, when you're talking about pelvic floor issues, what I would love for anybody listening to take away is, one, there is help. right? There is help for your bowel issues, for your bladder issues, for your sexual dysfunction. There is help. And then also, you know, find somebody that you resonate with, you know, find somebody that listens to you, find somebody that kind of, you know, can empathize with you, and that'll get you the results that you need.
Awesome. This was so good, Jay. So just to summarize, guys, for you guys that are listening, finding a pelvic floor specialist is no different than finding any other person that would be able to help you with your issues. And it seems like Jay's dropping off. I'm going to keep talking. She's going to keep, yep, there she is. She's back on. Okay, guys, do your research. You know, this is such an intimate topic. It is so easy to get discouraged. It's so easy to get embarrassed about what's going on. But professionals like Jay and other pelvic floor therapists that are out there are there to help you. They are specialists in this area. They see this stuff every time. So there's no need to be embarrassed. There's no need to feel ashamed. They can help you with some really things that can really change the quality of your life, as Jay said. And for those guys who may not have that big interruption to their lives in terms of, you know, their bowel and bladder and sexual function are fine. If you feel that you are having consistent back pain, those chronic back pain patients who are like, my pain was great, but it's just always just that one thing. Or even for my dancers that are having constant SI joint pain and hip problems as you go through your dance routines, you go through your rond de jambe, all that fun stuff. And if you consistently are having issues, it may be time to change directions and look at something else that may be causing your pain. And that may be a pelvic floor interaction and a consult with a pelvic floor therapist. So I really hope this was helpful for you guys. I wish that we could get on IG, but guys that are IG, please I'll post a link to the Facebook video for you guys to take a look at. Let's see if we have any questions in the audience. Let's take a look really quickly and see what we have.
You know, of these different.
So give me 1 second.
Yeah, and I mean, I like what you said when you spoke to, you know, especially the dancers, which is your population, about looking elsewhere for the potential cause of their issues. And I think that extends across the board, especially when we talk about our athletes, whether you're a runner, whether you're a martial artist. I actually have a martial artist that I was working with yesterday who is having pain, and her pain is coming as a result of those kicks. And it's not the front kick, it's the roundhouse. And I'm like, I probably could be a culprit, you know, especially because she's had a long-standing history. I say long-standing, it's been greater than 6 months of hip pain that's just continued to get worse. And so that's exactly what I was like, what I was thinking. I'm like, that's the culprit right there. So, you know, when we talk about our athletes, when we talk about people involved in dynamic movement and activity, you know, kind of think outside the box a little bit, especially if you realize this just isn't improving.
Yeah, exactly. And, you know, I just think it's so interesting. We got a comment from Miss Tamika, and Tamika said, yes, it's so important to just listen. Guys, one of the strongest things that you can have is a good relationship with your therapist to really hear all your concerns. We are here to listen and to figure out what your problem is and figure out what the next best step is. We are not here to judge. We are not here to condescend, to make you feel embarrassed or ashamed. This is an already sensitive topic. These are very highly skilled professionals that are able to help you and solve your problem. Give them a chance. Give yourself a chance to have a better life and quality of life if you're experiencing any sort of consistent chronic hip pain, back pain, and specifically maybe knee pain, or if you're having specific pelvic floor issues in terms of problems with your bladder, your bowels, or your sexual dysfunction. This is stuff that you guys really want to pay attention to. It is so important and it's so key. So I want to thank Miss Joanne so much for joining me, guys. She gave you everything. She gave you anatomy. She gave you some mechanics. She gave you the way that you are treated in terms of pelvic floor stuff. She gave you guys so much on this call. So I'm so thankful for her for joining us and helping us out understand the connection between the hip and the pelvic floor, how it may refer to you, and what you can do in order to get some help. I hope this was helpful for you guys. Drop me a comment, give me some hearts if this was helpful for you, share it out. If you know someone that is having this, you all can really benefit from this. We want to share this information, guys. It's all about sharing the love and the information so that we can all get better. Miss J, thank you so much. This was fun.
You are absolutely welcome, my dear. Absolutely, anytime.
All right, guys. So thank you, and we will see you guys later. Thanks for joining us. Bye.
Bye-bye.